this video is called Is Ozempic a Joke? Okay, so Ozempic is the GLP medicine, semaglutide, super duper popular. Tons of people are taking it all over the place. I personally know a bunch of people who are taking it. And so anyways, this internist friend of mine comes up to me and he says, Pete, what do you think of this Ozempic drug? I said, well, it's obviously stupid. Why pay $1,000 a month to take Gila monster venom when all you got to do is eat low-fat vegan diet, and low-fat vegans, they're always skinny, you know, so it's easy to lose the weight. Just eat low-fat vegan diet. Internist, yeah, this Ozempic, man, it's dangerous. It's not just a waste of money. It's really dangerous. He says, my friend put a patient on Byetta, which is like an earlier version of it. It's a different drug, but it's also one of these GLP drugs. And he said the patient got pancreas cancer pretty soon afterwards, and there were no other risk factors. So they thought it was related to the medicine. But that medicine, Byetta, got taken off the market in 2024. Me, yeah. I also heard Ozempic can cause pancreatitis. He goes, yeah, I've seen it cause pancreatitis. And pancreatitis can be a terrible disease. You know, pancreatitis, you can get pancreatic abscess, you can get pancreatic pseudocyst, all kinds of major complications, pancreatic necrosis, sepsis, hypotension, death, intubation, etc. Internist says, yeah, patients can die from pancreatitis, and once a patient has pancreatitis, they got increased risk getting pancreas cancer down the road. And I'm like, yeah, I buy that, but you know, pancreas cancer is not that common. I see tons of cancer, and I don't that often see pancreas cancer. Okay, it's just not one of the more common ones. I mean, I see colon cancer all the time, prostate cancer all the time, breast cancer is very common. I see tons of lung cancer, but not that much pancreas cancer. But pancreas cancer is kind of like lung cancer. It often kills the patient pretty rapidly, even more rapidly than lung cancer does. Internist, he says, yeah, and the other thing is Ozempic can cause blindness. And I'm like, me, wow. I looked it up real fast, and yeah, Ozempic is associated with increased risk of blindness, this unusual type of blindness called non-arteritic anterior ischemic neuropathy, NAION. Okay, but I can say I've seen tons of orbital MRIs and you know CTs at orbits. I've never seen a single one come in with the requisition, you know, possible Ozempic-related blindness. And of course, you know, internists, they're not going to blame it on the drug. They don't want to blame the doctor for that. But internist said I've seen one case of blindness that I think was due to Ozempic, which is actually rare because tons and tons of patients are on it. And me, I said, yeah, I know nurses, I know other people taking Ozempic. I've had a lot of people asking me if they should take it. Internists. In rodents, Ozempic is associated with increased risk of thyroid cancer. And I'm like, yeah, but, you know, again, nobody dies of thyroid cancer. In 30 years, I've only seen 2 people with metastatic adenopathy or, you know, metastatic lung nodules from thyroid cancer. We're pretty good at treating most thyroid cancer. There's subtypes of it that are worse, like the medullary subtype. But, you know, most of the papillary follicular responds pretty well from what I've seen to surgery and to I-131, for example. So the bottom line, though, what do I think of Ozempic? I think it's totally stupid. Why get yourself injected with Gila monster venom that could really hurt you when all you got to do is go low-fat vegan? You know, I actually had a young guy who was having all this chest pain and neurologic tremors and anxiety and sleeplessness after he took Ozempic. And then I told him he should take a vegan diet, and he basically said vegan diet's for pussies and all this stupid stuff. And he's afraid he'd lose muscle mass. And I'm like, look, pal, that's going to get you good blood flow. It often dramatically reduces the pain from neuropathies and the tingling and whatnot. You should try it. So eventually this guy tried it. And he said he just went low-fat vegan for 1 week. All his neuropathy went away. His anxiety went away. He was able to sleep. His chest tightness, it all went away. Pretty typical, you know. Anyways, I hope you found that out.